I feel like tech startup isn't something that's like natural to public health people. How did you kind of end up on that route or thought
Hmm.
process? And what advice maybe would you have for public health early career professionals, new graduates to get into that type of work?
Hmm. Yeah. I really wish I could pinpoint like why I wanted to bridge the two. So I lived in San Francisco for a year, and I was driving Lyft and working at the airport. So I drove a lot of San Francisco people around. I also took a class at Stanford while I was there, and obviously learning a lot about tech and AI. And as I thought about tech and AI as it relates to health, like again, we all know like where health is going, this personalized, real time kind of feedback, and being able to intervene in real time based on that data. And there was actually one time I was driving a passenger, and he was asking me, what I wanted to do with my life. He assumed that based on our conversation, my goal wasn't to be a Lyft driver my whole life. And I told him, yeah, I'm doing research over here at the university. I have this kind of like brand idea that I want to do, and da da da. And he's like, man, you got a lot of part-time things going on. And so I'm like, well, what do you do, or what do you do? And he said he built a company, sold it for $5 million, and now he just chills. And so that is really where I think I was first introduced to the concept of like building something and selling it, and then having enough money to not have to work, to pay the bills. It's not necessarily my vision to sell Bear Health, not in that way. But I think that those experiences planted a seed in my mind for what's the quickest way to solving a problem. That's really what I view startups as. Again, outside of policy, I view the startup approach as the most effective way to solve problems. So I think that's how kind of ultimately brought them together. And again, the problem is urgent to me. And so I didn't want to, based on, what I knew about how public health things typically move, I didn't want to deal with a lot of the red tape that's typically associated with public health. I didn't want to deal with the pace that's typically associated with public health in general. Less of a research focus, more of an action focus. Startups are a bit sexier than than and so again, like how do I get Black people to engage with health? That's what's at the root of everything that I think about and do right now as it relates to this. And public health is fine. The traditional landscape of public health is fine, but I think a public health startup is a bit more exciting to think about. Um, and so far so good. And again, you just have freedom. And I did not want to have to contend with people who don't agree with the ideas that we think are good for our community. Like I don't want to have to do that. It's part of why I haven't taken money from certain types of investors and stuff. Is because again, not just doing this to make money. Um, and so yeah, I didn't want certain challenges. And being at the speed is like a really, really big deal here because again, people are dying early every day and they don't have to. And so um, you also get to make impact like from the very beginning. We haven't even launched our official product yet. We will be launching it in October, but we've already had several users walk down or off their medication just from walking. Several users last year did 1 million steps in 30 days. This is before we got to talking about trying to go after the world record. But most of them lost 20 plus pounds just from walking. It was an idea I had for a campaign. Can I walk 1 million steps in 30 days to raise $1 million? Few people liked the idea and started doing it. And the impact is there. I can launch a campaign on any day that I want. And if it fails, then it's on me, it's whatever. But just the freedom to be able to move like that and test ideas faster than you would in a traditional setting. I hear all my friends talking about how they hate their bosses all the time. And if they were in charge of things, it would go this way. And I just prefer that freedom. And so if somebody wants to get into it, start. Pick a part of the problem that you want to solve and talk to as many people as possible who have that problem. Because one thing that I think public health professionals can appreciate or will appreciate about the startup space is that the foundation of a startup is that you talk to people with problems. You don't just have an idea and try to force it on people. You go talk to people that have problems, and you're not even necessarily coming with your idea to solve the problem. That's kind of the way that we did it, and that's not necessarily the best way to do it. I just didn't know any. When I came up with the idea, I didn't know the best approach. But my view of health equity is, and community-based participatory research is that you don't identify a problem in the community, develop a solution, and then go try to implement it. You go talk to the community, ask them what their problems are, and then try to help them solve those problems. Now, whether or not you implement your solution or idea or not is not relevant to the situation. Your job is to solve problems for people. And then you might develop solutions as a result. And then you might have a company as a result. And so I think public health professionals appreciate that, especially those of us who are in the health equity space, that we get to go and talk to people directly, find out what their problems are, and then develop solutions based on that, as opposed to the kind of top-down model of solving problems. And so if you want to get into it, that's it. Just start. That's what startups are about. Go talk to people with the problem and go test solutions against that problem. And then once you get what they call a product market fit, where you're solving an urgent problem for someone who's willing to pay you for it, then you can go get some money and build a business. But yeah, just start. That's the mentality when it comes to this stuff. Just start solving the problem. You don't have to get this business idea put together and this plan put together. Just go start solving problems for people, and you might find a business.
Well, I appreciate your insights there. And I think it's so important to like just highlight people with public health backgrounds in this kind of tech startup world, because I feel like the lens and the perspective and the issues that we're solving are such important ones. And to your point, so impactful if we're able to make that, if we're able to meet the need that we're really trying to meet the need of. So I appreciate you for doing this work and for trailblazing in many ways. And I hope that there are many people that look up to you and say, hey, Kwame is doing something around an issue that's important. Let me do something very similar,
Even
and maybe even reach out to you and collaborate. So I appreciate you sharing that.
of course, I'm trying as hard as I can, and I hope that message is received and that characteristic is adopted, because that's how you give yourself the best chance at success in whatever it is that you're trying to do, whether you're trying to solve a public health problem or just have a good life. Try hard.